As of yesterday, the total number of jabs or doses have received more than 100 million, and we've seen some inflexible policies or compulsory vaccination policies in some places, which has to be called an end to. And today we will have several speakers to brief you on the latest situation. We have Mr. Liu Peijun from the Ministry of Education, and Mr. Wu Liangyou from National Health Commission, and Mr. Wu Zunyou from China CDC, and Mr. Wang Huaqing from China CDC, from Sinovac, Mr. Liu Peijun, and they will be taking your questions in today's press conference. And now please raise your questions and identify yourself before asking a question. Currently, more than 160 million people have received vaccination. So how do you evaluate on the level of the vaccinations, and do you have any good practices you want to share? And I will refer this question to Mr. Wu. Thank you for the question. Currently, the vaccination work in China is advancing steadily. As of April the 10th, the total number of doses reached more than 160 million and ranking second worldwide. According to arrangement of the State Council and Central Commission, we have two priorities in terms of vaccination. First, we need to prioritize the key areas, and we need to give priority to those with higher risks, such as borders, major cities, and places where epidemic have broken out in past time. And second, we need to prioritize the crowds or the key groups. For example, those who are working in the delivery business, in the department stores, in supermarkets, and in medical industry, as well as those work in the logistic industry, and so on. And currently, we have been seeing very smooth progress in terms of vaccination, and good practice have been accumulated. For example, in the city of Beijing, for all the institutions and companies, we have already give them green labels. That's a signature for successful vaccination. In Shanghai, there are also policies to register the number of people who have been vaccinated. In Zhejiang province, the community worker communicate with the residents in order to ease their mood and shorten the period of waiting. In the province of Shandong, and multiple forms of vaccination have been organized. For example, this kind of green area was deployed in key places, and for example, in supermarkets and department store. In Hubei province, there are also vaccination carts that drove to people's living quarters to give vaccinations and doses. And these good practices will be promoted countrywide. Next question, please. And with Renmin Daily, how did MOE and the universities promote the work of vaccination for university students? So can you brief us on the situation in that regard? So, Mr. Liu, would you take that? Thank you for your interest in our work. The educational system attaches great importance to the vaccination of university students. We've been deploying our work according to the requirement of the State Council, and since February this year, we've taken multiple measures to coordinate the work for university students. So first of all, on February, we have been working with the National Health Commission to issue a notice on the third edition of Prevention Control COVID-19 on university campuses, according to which the teachers and students in universities can volunteer to get vaccinated. And on April the 1st, we issued yet another notice on the vaccination in educational system. So all the educational institutions have to realize the importance of vaccination in order to advance the work in a more smooth way. On April the 2nd in Chengdu, the MOE held a meeting on health work in universities, according to which the local educational administrations have to continue to push forward the work in this regard. And it's important to count the situation or to evaluate the situation of vaccination for college students. We also ask for good practices to be registered and to be promoted. So this is one of our first priorities in prevention and control of the epidemic in universities. So we are basically seeing very smooth progress in this regard. For example, in Tsinghua University, they began vaccination for students on campus from March the 1st. And they have gained very good experiences in this regard. And they are working with the community and the CDC to help with the organization and arrangement for the site for vaccination. So we need to provide good services to the faculty and the students. Generally speaking, nationwide, and we are seeing very smooth progress. Next question, please. With CMG, the past few rebounds happened in mainly the northern part of China, but the latest rebound occurred in Ruili city, which is at the southern part of the country at the border. So how do we prevent similar rebounds from happening again? Thank you for the question. So there are multiple factors that affect the outbreak of the epidemic. Last winter, for example, we saw multiple rebounds in northern cities and provinces. This is mainly due to the low temperature in winter in northern China. The virus can exist longer, and the ventilation in indoor environment is poor. Second factor is the implementation of prevention and control measures. As long as we can implement the control measures well, even in low temperature, we can still manage to control the epidemic and prevent it from happening again. So epidemic may still come back if we loosen up our measures. For example, in many places, in many places in Asian countries with a daily temperature of over 30 degrees Celsius, they are still experiencing major spread and major outbreak of the epidemic, and this kind of development rate is even faster in some of the most severely affected countries in the European countries and the North America. So currently, globally speaking, we're still at a very high rate of infection, and on a daily basis, 300,000 to 500,000 new cases were reported, and we're still facing risks in terms of import cases. Second reminder, despite the cold winter and the spring travel, the policies that we have taken should not be loosened up. I also want to remind you that sometimes with the coming of the spring, people may feel relaxed, and they may not feel that it's not that urgent, and some of them may let their guard down. I think it's still important for us to wear masks, to wash our hands frequently, and keep ventilation in public places. Thank you. Next question, please. My question is also about the outbreak in Ruili City, Yunnan Province. And in Ruili City, vaccination work is also going on, hand in hand with prevention control measures. So do you have any new experiences that you'd like to share with us? Mr. Wu, please. Thank you for the question. From last year to this year, we have seen more than a dozen of rebounds or new outbreaks across the country, but the general principle of prevention and controls are quite similar. It's still early detection and early reporting, early identification, and early diagnosis and treatment. So these series of policies can take effect within 1 to 2 weeks. The outbreak in Ruili is quite complex because the city of Ruili locates at the border of China, so it not only includes the Chinese, but also there are foreign cases. Therefore, it's important for us to do this kind of epidemiological investigation, because sometimes it's harder for us to trace the history of some of the cases if they are coming from other countries. And currently, Ruili, together with other cities, are advancing their vaccination progress and work. And we are aiming at to vaccinate the whole city as soon as possible. As a small city at the border, the city of Ruili is facing much higher risk compared to other inland cities. So we need to protect our people with wide coverage of vaccination. Next question, please. My question is also about the outbreak of Ruili. And all the cities, all the schools have suspended their offsite, their offline education. So, do you have other arrangement in this specific case? Since the outbreak of the epidemic on March the 30th, the Ministry of Education Special Group on COVID-19 Prevention and Control has given very rapid response And together with the Administration of Education in Yunnan Province, we have kicked off the level 1 emergency response and made arrangement accordingly. We need to make arrangement of the work in schools. Generally speaking, the prevention and control situation in Dehong and Ruili are quite stable, and the schools are working with the local government to help with the quarantine for local faculty and students, as well as relevant epidemiological investigation. And we have also adjusted the education, the teaching plan for the schools. The students are now staying at home to receive online courses. And for the graduate class, they are also receiving relevant help and classes online, even though they cannot, for the moment, take classes offline. But they can still receive these courses. They can also receive the instructions of the students, of the teachers, from online platforms. We need to make sure that the students can stay safe and stay healthy, both physically and psychologically. Coming up, we'll also be working closely with the local administration to ensure the safety and order of the local educational system, so that students can keep learning even during special period of time, while cooperating with the local CDC, the health commissions, and the government to join the effort of prevention and control measures. Thank you. Next question, please. With Phoenix TV. Some foreign press reports that the biggest problem with the Chinese vaccine is that if someone were infected with COVID-19 after vaccination, this kind of immunity inside his or her body may worsen or may causing to the deterioration of the disease. How do you comment on that? Thank you so much. The vaccination of Sinovac have done clinical trials in many foreign countries. We can see that the trial group's effect is much better than the contrast group. And the total number of vaccination in foreign countries have exceeded 130 vaccination, and the phenomenon you've described have not been reported and have not been observed in any of the cases that we have observed. Thank you. With CMG's Financial Programming Center, there are some places that have implemented mandatory policies asking that all people get vaccinated regardless of their health conditions. And some even link this kind of vaccination rate with the company's performance and evaluation. So how do you comment on that kind of phenomenon? Mr. Wu, thank you for the question. Currently, the local government are advancing the work of vaccination in an orderly fashion according to the requirement of the State Council. There are provinces that have taken different kind of effective measures to encourage the vaccination progress. As I have introduced to you, We have a lot of successful experiences in Beijing, for example. But as you mentioned, there are a few cases when this kind of simplistic measures have been taken. These are not universal problems, but it does affect some of the problems in terms of administration in some areas in vaccination. And coming up, we will strengthen our administration. We will ask the local governments to improve their level of administration and arrange the work properly according to the law and according to the regulation. Arrange the time and number of people properly and avoid crowd accumulation. And act according to the standard operational principle and procedure. We'd also brief the public on some of the implications and some normal reactions after vaccination. But it's important to know that vaccination is effective measures to protect personal health, but also an important measures to build this immunity barrier that protect our elderly and young. Therefore, we believe that we need to vaccinate all those that need to be vaccinated or wanted to be vaccinated. We need to we need to make efforts to encourage more people to get vaccinated. Currently, we have university students who are very concerned with the vaccination of COVID-19. And people, they are worried about whether they can be injected with HPV after the injection of COVID-19 vaccine. And they are also worried about their health conditions. So can you tell us more about that? Based on past experiences, there are two things you need to consider. First, whether it's an inactivated vaccine or whether there are counter elements in different vaccines. If their antibodies are similar or the same, you need to take some time before you get the second dose. So both HPV and the COVID-19 vaccination are inactivated vaccine, so they should not affect each other in terms of their efficacy. But for safety concerns, we ask that you shouldn't be vaccinated at the same time. That is to say, if you just get the jabs of COVID, it is not advisable for you to get HPV jabs and other vaccines. This is for out of the consideration for the consideration of reactions, of bad reactions after vaccination. But if you have the need to get rabies vaccines, you should be vaccinated immediately without considering this kind of discomforting reactions. According to clinical trials and our monitor of the untoward effect of vaccination, Most of the effects that we have observed are mild and normal. But if you experience a very drastic untoward effect, you should seek doctor's advice immediately. We do observe few cases of a drastic reaction or effect, but we believe that it's mostly due to some psychological conditions. People feel too nervous before or after vaccination. So we want to express, or we want to stress that you need to be relaxed during, before, and after vaccination. According to the technological standard and guidelines, for those with acute and chronic diseases, it is not advisable to get vaccinated. But what about some of the chronic diseases, such as high pressure or sore throat? And some of this kind of people, they're asked to take some time before get vaccination. So can you give us more specific instructions as to how and when to be vaccinated? Not long ago, we have issued the guidelines on vaccination. This is to address some of the problems in vaccination at the grassroots level. We also ask to minimize the risks for vaccination. According to this guideline, there are several situations, as you mentioned. First, if you're allergic to coronavirus, it's not advisable to get infection. And second, if you experience major allergies in past vaccination history. 3, if you are experiencing diseases in the neural system, including epilepsy, and fourth condition, it is not advisable to get vaccinated if you are experiencing acute diseases or chronic diseases, that is very severe ones. Last, we do not give vaccination to pregnant women. So besides the allergy situations, the other conditions are temporary. For example, if you're experiencing acute disease, you shouldn't get vaccinated. But if you have recovered, you can get vaccination. And if your chronic condition is kept under control, you can also get vaccination. So the other 4 situations are temporary. And you can take some time before get vaccination. You can wait till your conditions have finished. However, if you're experiencing severe allergic condition after you receive the first jab, you shouldn't get the second jab. So for common conditions, such as rhinitis, as well as sore throat, they can get vaccination. So we advise that if you want to get vaccination, to keep a healthy condition and a living habit pre and after vaccination. For example, you shouldn't drink too much alcohol because it might hinder your immune system. According to the guidelines, there are also other conditions. Some people are taking drugs that has this kind of anti-immunity content. Therefore, we advise people to show the prescriptions to the doctors who are giving out vaccination, so that the doctors can make a proper judgment. All of these guidelines are for better efficiency and effectiveness of vaccination. But we have to stress that you need to brief the doctors on your medical history and also your prescriptions. It is important to be honest when the doctors ask about your medical history, so as to ensure the efficacy of the vaccination. Thank you. There are parents who are worried about the untoward effect after vaccination. So can you tell us more on the information in that regard? Thank you for your concern on the vaccination in schools. According to the deployment of the MOE, we are working with the local administrations on the education and campaign for vaccination. Students, especially college students, should have full-fledged, comprehensive information on vaccination and its adverse reactions. So first of all, the faculty, the parents, as well as the students must realize the importance of vaccination. So this is an important measure in the prevention control of COVID-19 on campus. The students should understand that the vaccination is implemented according to the law and regulations and is conducted in a voluntary and free way. We need to improve the willingness of vaccination across the campus. We have multiple ways of education and campaign, for example, through the official website, through their official account. The university students have been made fully aware of the safety and efficacy of the vaccination. it is also part of their social responsibility to get vaccinated if their health conditions allow. Thank you very much. I'm with AP. This question is what Mr. Gao Fu has mentioned from the CDC. Yesterday, Mr. Gao mentioned that the efficacy rate and protection rate of vaccination is not very high. So my question is, what kind of considerations do you have? There are countries that are using vaccines developed and produced in China. And do you have specific guidelines for vaccinations for them? So, Mr. Wang, please. This time, in coping with COVID-19, we see that all countries are advancing the R&D of vaccination in all measures possible, and China is no exception. We have this M2 vaccine and nucleic acid vaccine. Currently, we have M2 vaccine, which has now gone to clinical trials. That is the first question. And second, during the process of prevention control of COVID-19, as well as during the vaccination process, different countries may have different strategies in terms of vaccination policies and strategies. And the WHO has different guidelines for all the different countries. So the countries may have their own policies and considerations when choosing their vaccination policy and the types of vaccination. That's all I want to say at this point. Mr. Liu, do you have anything to add? During the third trimester of clinical trials, the efficacy of the vaccination is a conclusion that's reached due to this contrast between the trial group and the contrast group. That is the one that gets vaccination and the ones that are not vaccinated. We see that the protection rate of the vaccination is affected by local condition, by the different strains in different areas. So the Sinovac vaccination have done clinical trials in different regions of the world, and the results are quite different from place to place. We have also tested different intervals during 2 jabs. And currently, we advise that 2 to 3 weeks between jabs. That is our recommendation at the moment. According to some of the reports, in Chile, 1/3 of the population have got vaccination, but their number of new cases are still rising. So how do you comment on that phenomenon? That is a very good question. According to the numbers of the WHO, we have noticed that in January and February, we saw the number have decreased. However, from March, we see very clear rebound in countries such as Brazil and India. The country of Chile, from last year to this year, are experiencing very gradual increase in terms of new cases. April last year, their daily cases is about 2,000. However, this year, the number has risen to 8,000. That's from December last year to April this year. And their vaccination work began in February. And currently, about 1/3 of the populations have at least get one jab. So this kind of ratio is not enough to build this crowd immunity. So it concerns the two concepts of vaccination in terms of this protection effect. So the first effect is this kind of protection effect against individuals. As Mr. Liu from Sinovac has mentioned, in the clinical trials, this is what we are looking at, the protection rate on individuals. Whether an individual, a person, can produce antibodies after vaccination. Second, when there are certain ratio or proportion of people in a crowd that's been vaccinated, it will protect the whole crowd. This is the concept of crowd immunity. So different infection disease have different rate in order to generate crowd immunity. This mainly concerns the infection rate of different diseases. And for COVID, in the case of COVID, the vaccination rate should reach around 70 to 80% in order to reach crowd immunity. So 10%, 20%, and 40% is not enough for crowd immunity. It's only enough to protect the individuals, not the crowd. So that's why all countries are striving to reach crowd immunity, that is more than 70 to 80% of vaccination before winter. Next question, please.
好的，谢谢主持人。红星新闻记者提问。一般呢
，With Hongxin News.
到获批使用大概需要多长时间？那么对于我
How long does it take for a vaccine to be ratified to marketize, and how long does the Chinese vaccine take? And when will Sinopharm and Sinovac's vaccine get to the ratification from WHO? Mr. Liu, please. So development period for a new vaccine would undergo 3 terms of trials and 4 clinical trials before vaccination in the massive crowds. In traditional R&D period, they are taken one step after another to address key issues and uncertainties. So we need big investment in terms of R&D of a new vaccine. And the business would also have to, the pharmaceutical companies will also need to work with relevant parties and external powers to do research before moving on from one step to another. And we also need to wait in line for ratification. However, due to the urgency for the prevention and control of COVID-19, We have expedited this process and received massive support from all sides. We not only guarantee the quality of the vaccine, we have also maximized the efficiency and have minimized the time of research and development. Within 1 year, Sinovac's vaccine can now reach a yearly production of 2 billion doses. During Spring Festival, Sinovac has undergone this on-site inspection from WHO on the production line, and we're expecting to receive an emergency authorization from the WHO in no time. After that, the WHO will give us a grant for vaccination, and we are also hoping this kind of ratification from the WHO will come as soon as possible. Thank you. With China Education TV, Mr. Liu has mentioned that the MOE has made deployment and issuance in terms of the notice on vaccination in universities and colleges. So my question is, compared to the public, what are the points that we need to pay special attention to on campus? We have a large base in terms of college students. So how do you guarantee that this kind of vaccination can be effective and universal? As you mentioned, in educational system, we have some different things that we need to focus compared to the society. For example, the students are living in a relevantly accumulated manner. So here's our arrangement. First of all, we need to coordinate the different aspects. So first is the 3 includes. First, we need to be included in the national plan for vaccination. And second is that the education system should be included to the local prevention control measures. And third, that is to include it to the whole prevention control measures of the educational system. So our vaccination rate, our vaccination work should be well coordinated. It should be well coordinated with the national vaccination plan in terms of services and processes of vaccination. We also ask that the local administrations act according to the national administration to make sure the smooth and safe vaccination process on campuses. As Mr. Wu mentioned, it is important for us to form this good environment of receiving vaccination. Second, we also need to coordinate our vaccination work with that of the local government. So it should be part of the big plan at the local level. So we are working closely with the communities and the general public. The educational administration should be working closely with the local health commissions and CDC to organize the vaccination work well. The universities should also provide services, the much needed services, pre and after the vaccination for faculties and students. And 3, we need to carry out education and campaign in terms of vaccination. The MOE have been working with the colleges and universities to help the students and faculty understand the importance of vaccination for personal health and the safety and health of the whole society. The students are fully aware of the situation, and the majority of the students have shown high willingness in terms of vaccination. Coming up, we'll continue our work along this line so that more students can get vaccinated if their health conditions allow. It's an important measure to ensure a safe and healthy campus. Next question, please.
谢谢主持人。中国日报记者提问：我们注意到近日世卫组织免疫战略
With China Daily,
国药和
the WHO panels of experts have shown that the vaccination and safety rate of Sinopharm and Sinovac vaccine are up to standard. But there are other reports from foreign media that question the efficacy and safety of the Chinese-made the vaccines that are made in China. So can you tell us more about the statistics in this regard? Actually, you could refer to our press conference on March 28th on the efficacy, but we have some latest updates in terms of the numbers. On April the 3rd, we have issued these clinical trials on our official website in both English and Chinese. And we've also issued papers on the Lancet in terms of the trials of the vaccine. In Brazil, Chile, and Indonesia, we have done the third term of trials, and we have already submitted the papers to the Lancet. And we're now compiling the research paper in Turkey, clinical trials. Thank you for your interest, and please follow closely our latest update in terms of research and development of the vaccine. Last 2 questions. With South China Morning Post, during the May Day holiday, many people may choose to travel around. So do you have any advice for the holiday season? We are going to have a 5-day break during the May Day holiday. With the effective control of the Ruili outbreak, we are generally speaking experiencing very good condition in terms of prevention and control. So at the community level, there are no cases. So that gives us a green light for the May Day holiday. However, the rebound in Yunnan keeps reminding us that as long as the epidemic in foreign countries are still ongoing, we shouldn't loosen up and shouldn't let our guards down. We encourage people to go out and enjoy the beautiful spring during the May Day holiday. However, we shouldn't loosen up our control measures. We still advise against large gatherings during the holidays. During travels, make sure that you implement the personal protection measures, wear masks, keep social distance, wash your hands, and keep ventilation. As long as our individuals can keep their guards, do not let their guards down, we can minimize the risk of rebounds while enjoying this beautiful spring. Last question, please. Thank you. With China Youth Daily, my question goes to Mr. Liu from MOE. With the ending of this holiday season in April, we are now going to have the entrance exam for high school and universities. So how do you guarantee the safety and implement effective control measures during the entrance exams? The MOE has already issued the notice on the enrollment of university students, and the entrance exam will take place in June this year. And the exam will take place according to the prevention control measures at the local level, and the measures should adjust according to the changes of epidemic prevention control. It is important and of paramount importance for us to guarantee the safety of the public places, such as the examination site, as well as the grading sites, so as to ensure the health and safety for all the participants of the exams. As for the entrance exam for high schools, the local governments are mainly taking responsibilities in this regard. Generally speaking, our country is facing very good condition in terms of prevention control of COVID. So all we have to do is to monitor closely the changes. And the MOE has made two arrangements. First is that we ask the local administrations to make specific work plans towards the entrance exams of high schools. And we also ask them to implement emergency plans in case some emergency happens. For example, we will set aside a examination site for quarantined. And second, if a rebound should happen during the examination, this kind of contingency plan will take place. And we will adjust the time for the exam if it's absolutely necessary. So it is fair to say that we are fully prepared for the organization of the two important exams. Thank you so much for your briefing on the vaccination, especially the situation in university and colleges. And later, we will be holding more press conferences on similar topics.